5, 4, 3, 2. So perfect. Dr. Lyons, I know that your many years of experience as a surgeon, you're asked the same questions by patients. So today I would like to review the most common questions you answer when meeting with your patients pertaining to our in-office liposuction procedure. I know patients come to you, both men and women, of various ages and ethnicities, and definitely different shapes and sizes, but it seems that they always come back to ask you the same basic questions. So if you would tell me, how does the Slim Lipo differ from regular liposuction?
Well, Megan, as you know, I've been doing liposuction for a long time. The generic liposuction, meaning where everyone knows where you take a tube, connect it to a suction machine, and you take away fat to make somebody less fat or look to have a better shape. Through the years, liposuction has changed dramatically as far as the levels of technique. Very crude in the early 80s, very sophisticated in the 2000s, extremely sophisticated in 2014. A couple of years ago, the laser technology was introduced into the liposuction process. And what that did is revolutionize the ability to refine liposuction to a level that really matches what's going on in the world. Is that most people are not here because they're fat. They're here because they've done the best they can in the gym. They've done the best they can by eating well, and they just can't get rid of certain bulges and deposits of fat in their body secondary to either their gender, hormones, their age, again hormones, or their specific lifestyle. So what Slim Lipo does, it introduces the ability to use special instrumentation, very refined, along with laser technology, to actually melt fat and remove the melted fat or fatty acids so that we achieve very fine contours. We get areas of fat that would not be removed in any other way than with liposuction, are impossible to remove with diet and exercise, and get bodies and shapes that really insinuate youth, and get my patients to a level I never could have gotten them even 5 years ago. So it's a whole new horizon for me.
So this particular procedure, does this require general anesthesia?
Another big boom in the market for liposuction is the ability to perform this technique because of its sensitivity and elegance under local anesthesia. Believe it or not, we do these cases here in the office under local anesthesia. Patients are extremely comfortable, and some of them actually say they feel like they got a massage. In my experience, very few patients have ever been unable to do the process. They analyze the experience very similar to having dental work, or maybe even better. So what we do is we actually make just little tiny puncture wounds, not even incisions, so there's no scars, and through this we inject or infuse a dilute solution of lidocaine, a local anesthetic, in the entire area. For instance, the stomach or the arm or the thigh is completely numb, just like this table would feel to somebody if you're touching the table and not their thigh. And then the process is that we use the laser to melt the fat and gentle liposuction technique to remove the fatty acids, which is the liquid after dissolution of the fat, with the laser technique. So it's very, very comfortable, very simple, straightforward, and quick technique here in the office.
So based on your experience, what is your consensus from patients of the recovery time and what they can anticipate?
You know, most of my patients are in shock as to how simple it is to perform the technique and then to recover. We're very much on them in the recovery to answer any questions or issues, though the directive is to just rest that evening. They have a compressive garment on to decrease the initial swelling, and to do really whatever feels good the next day. There's no way you're going to do anything that's going to hurt anything or cause any complications, bleeding, etc. As long as it feels okay, you could do it. So most of my patients who have sedentary work, office work, can actually work the next day with any area of liposuction. Back to the gym, probably within 1 week, 5 days to a week, doing light cardio and moving on as they feel good, but certainly a very limited recovery phase.
Now, what about the quality of the patient's skin after the fat is removed and the volume decreases.
Well, quality of skin is a huge issue when you talk about liposuction. If you use the metaphor of a pillow, so when you think about changing the shape of a pillow, I'm presented with pillows every day that have different shapes and contours, not always big or small, but bulges on the pillows, if you will. Those are the patients. So what the liposuction does is get rid of the feathers, but then in some cases the pillowcase is in good enough shape to recreate the contour you just created by removing the feathers. In some cases the pillowcase is too stretched or too much pillowcase left, so you have to tighten the pillowcase. One of the advantages of SlimLipo, laser lipo, is the ability to secondarily, that is after you take out the fat, use the laser to tighten the skin. So it allows me to take more fat, that is feathers from the pillowcase, and get a better result, and also allows my patients to have better looking skin. So with the addition of this technique to the liposuction, we have a whole new horizon once again of possibilities as to the level of liposuction. Very artistic.
Now, as far as our final question, I'm sure that you get asked this most frequently. If I gain weight, or if the patient gains weight, will that fat return to the area?
Certainly every patient asks this question, they should. If one understands the indication for liposuction, which is lipodystrophy, that is a collection of fat, if you will, a bulge, somewhere on your body that doesn't change in relation to the rest of your body no matter what you weigh. So if you weigh 50 pounds or 300 pounds, that area is always bigger than the other areas. That's when liposuction is effective. So what I actually do with liposuction is bring that area into phase with the rest of the body. Once I've done that, for the rest of that person's life, the Hog cells from that area have been removed, and therefore if they do gain weight, they don't get the shape that they had before. For instance, if your selective area of fat collection, which it is with most men and a lot of women, is the central abdominal zone around the belly button, if I remove that zone of Hog cells, if that patient did gain 25, 30 pounds, they would not get a big protuberant abdomen again. They might get another area where the fat would collect out of phase with the shape of the rest of their body. So it's all about shape, all about contour, all about bulges.
Doctor, thank you for your time today. We appreciate it and look forward to hearing more about this procedure and other procedures that you do here in the office.
Thank you, Megan.